Hi, I'm Stephanie Apt, and today I'm talking about the best Medicare supplement plans for 2019. So stick around. So when it comes to Medicare supplement insurance, you have a lot of different options. There are all different plan letters, Plan G, Plan F, Plan N, high deductible Plan F. On top of that, there are also lots of different insurance companies that offer all of these different plans. So what are the best Medicare supplement plans and the best companies for 2019? Well, let's break it down. So up here is a chart showing the standardized Medicare supplement plans. So these are plans lettered A through N. And when most people look at this chart, it's confusing, right? It seems a little bit overwhelming. There's all kinds of different letters and different things to look at. But really what you need to know is there's only a few plans that even make sense to purchase based on the cost versus benefits ratio. So there's really only a few plans that are popular. Let's start off by talking about Medicare Supplement Plan F. Now, Plan F has historically been the most popular Medicare supplement plan because it covers the most. So it's the plan that offers first dollar coverage, which means it covers 100% of your Medicare Part A and B expenses, and you pay zero out of pocket. So there's no deductible for you, no copays, nothing out of pocket at the doctor and hospital. Plan F is very easy to talk about, very simple to explain. It covers everything at 100%. So it sounds great, but the thing is you are paying a much higher premium for that plan. And something else that I want to note is that in the year 2020, Plan F is going to be sunsetting for any new Medicare beneficiaries. So what that means is that Plan F will no longer be offered to anyone who's turning 65 year 2020 or later. Now, if you have a Plan F already or you purchase a Plan F today, you will be able to keep it past year 2020. You can keep it as long as you want because you'll be grandfathered into that plan. But no one who is newly turning 65 year 2020 or later will be able to purchase Plan F. Now, what this means is you can probably expect higher than average rate increases on your Plan F after the year 2020. And this is because it's going to become a closed risk pool now with an aging population. No one newly turning 65 coming onto the plan to even out the risk. So for 2019, I would not recommend Medicare Supplement Plan F as one of the best Medicare supplement plans. I think that for a little bit more out-of-pocket exposure, you can end up saving a lot of money over the life of your policy by going with another great Medicare supplement plan. So in 2019, in my humble opinion, the best Medicare supplement plans will be Plan G and Plan N. Now, Plan G is almost identical to Plan F. There is only one difference, and that is the Medicare Part B deductible. Now, the Medicare Part B deductible has varied a little bit since Medicare has gone into effect. For this year, currently, it's $183 per year. And again, that can change. It's not set in stone. It usually doesn't vary by too much. It's always stayed under $200 a year. This is an annual deductible that you have to meet before the insurance company kicks in. So with Plan G, you pay your annual Medicare Part B deductible. It's $183 per year this year. And then after that, your plan works just like Plan F. It pays 100% of all of your Medicare Part A and B doctor and hospital charges. But Plan G is often priced a lot lower than Plan F, much lower than that $183 deductible that you have to pay. So typically it's going to be a better value to go with Plan G. You have a little bit more out-of-pocket exposure with that small annual deductible, but you end up saving a whole lot more money on your monthly premium. Medicare Supplement Plan N is another great option that's been growing in popularity a lot. It's similar to Medicare Supplement Plan G. It does not cover the Part B deductible. So again, you have that $183 of medical expenses that you have to pay. And then after that, you do potentially have copays at the provider. So these copays can vary anywhere from $0 to $20 at your provider's office and anywhere from $0 to $50 at the emergency room. So Plan N is a great option for folks that are, in relatively good health. They don't usually go to the doctor. And if they do have to go to the doctor, they don't mind paying a small copay. The only other difference between Plan N and Plan G is that Plan N does not cover the Medicare Part B excess charges. Now, I'll preface this by saying Medicare Part B excess charges are rare, but I'll talk a little bit about them. Medicare Part B excess charges can happen if you go to a doctor that accepts Medicare but does not accept Medicare assignment. So it's possible to see a doctor who accepts Medicare patients, but they don't accept Medicare as payment in full. In this situation, the doctor could bill you up to 15% above the Medicare approved amount for that service or procedure, and those would be Medicare excess charges. They are covered by Plan G at 100%. You'd never see them. With Plan N, they're not covered. Now, excess charges are extremely rare. Most doctors that accept Medicare do accept Medicare assignment. I'm going to tag a video up here that will show you exactly how to find out if your doctor accepts Medicare assignment so you can know whether or not to expect excess charges. But you do have to know that if you go with Plan N, that is something that you're taking a small risk on, would be those excess charges because they're not covered. Now, Medicare supplement plans are all standardized. So once you figure out which plan letter you'd like to go with, you can get that plan typically from dozens of different insurance companies. And no matter what insurance company you decide to go with, it will always be the same exact plan, same exact benefits. So which insurance company is the best? Well, that's going to depend on a few different things. The first thing it's going to depend on is your area. So rates can vary greatly for Medicare supplement plans from one area to another. Additionally, the way plans are rated can vary from one area to another. In some areas, you're going to see all attained age rated policies. In other areas, you'll see issue age rated policies. So you really do want to talk to a professional, an independent broker that can help you go over the different rates for these plans in your areas and which companies are offering these plans at the most competitive rates. And that's something I would be more than happy to help with. Just go ahead and give me a call and I'd be happy to talk to you about all of the different plan rates in your area. So in summary, that's a little bit about the best Medicare supplement plans for 2019. If you have any more questions, please feel free to reach out. Thank you so much for watching and we'll see you soon.